head injuries can be very challenging patients to manage in the back of an ambulance. Let's face it, there's a lot that can go wrong with a head injury patient. They can have seizures, they can have a host of airway problems, they need to remain immobilized. They have vital sign issues. They can do odd things with their vital signs that we may or may not understand. Their mentation can change on us rapidly. They can be combative. When you're managing a head injury patient, I want to give you a couple ideas to keep in mind or think about. Hi, I'm Steve Whitehead, and this is EMS1's Remember Two Things. Let's talk about two nevers in the closed head injury patient management arena. Two things that I want you to think about, and if you can focus on these two things, you'll do a world of good for your patient. The first thing is never let a head injury patient become hypoxic. If you suspect your patient has a closed head injury, if they have altered mentation and you see that they start to hypoventilate, if they vomit while they're in C-spine, if they have some airway issue, that has to become your first priority. Probably the worst thing we can do for a patient with a closed head injury is allow them to have even a single hypoxic event. So we really need to focus on that airway above all patient management issues. The second thing we definitely want to think about is that we never let a closed head injury patient become hypotensive. We just talked about the airway, and we used to do some things with the airway of a head injury patient to try to reduce intracranial pressure. Do you remember that? We used to say we want to really hyperventilate them, give a whole lot of ventilations, and we've actually decided that's probably not the best idea, right? If we have capnography, bringing them into a normocapnic or slightly hypocapnic range with our ventilations is perfectly fine. But actually what'll do much more for their cerebral perfusion is to keep their systemic blood pressure up where we want it to be in at least a normal range. So when we're managing that head injury patient, we want to pay such close attention to the blood pressure. Keep going back to that blood pressure vital sign and monitor, because even a single hypotensive event can really decrease their chances for a positive outcome. So the next time you have that closed head injury patient in the back of your ambulance, I'd like you to remember two things. Never let them get hypoxic, and never let them get hypotensive. Thanks for listening. I'm Steve Whitehead, and this has been EMS1's Remember Two Things.